Hello everyone. Today, we're exploring the medication Mobic, also known by its generic name, Meloxicam. This discussion is intended for educational purposes only. If you have health-related questions or need medical advice, please consult a healthcare professional. Description: Meloxicam, marketed under the brand name Mobic, is an oral medication that belongs to a class of drugs known as nonsteroidal anti-inflammatory drugs, NSAIDs. It is primarily used to reduce pain, inflammation, and stiffness caused by osteoarthritis and rheumatoid arthritis. Meloxicam works by inhibiting the enzymes responsible for inflammation and pain in the body. It is available in tablet form and is usually taken once a day, with or without food. Prescribed for its anti-inflammatory and analgesic properties, Meloxicam is also sometimes recommended to treat juvenile rheumatoid arthritis in children who are at least 2 years old. Warnings: Mobic should not be used by individuals who have had allergic reactions to Meloxicam or other NSAIDs. Caution is advised for people with a history of heart disease or stroke, as NSAIDs may increase the risk of serious cardiovascular thrombotic events, myocardial infarction, and stroke, which can be fatal. This risk may increase with duration of use and in patients with existing heart disease. Additionally, Mobic should be avoided before heart surgery. People with a history of stomach ulcers or gastrointestinal bleeding should also use Mobic with caution, as it can increase the risk of gastrointestinal bleeding, ulcers, and perforations of the stomach or intestines, which can be fatal. Before taking this medicine. Before starting Meloxicam, discuss your medical history with your healthcare provider, especially if you have heart disease, high blood pressure, cholesterol, diabetes, or if you smoke, as these conditions can increase your risk for heart-related side effects. Also, let your doctor know if you have a history of stomach ulcers, liver or kidney disease, fluid retention, or if you are taking any anticoagulants or other medications. If you are pregnant, planning to become pregnant, or breastfeeding, it is important to discuss the safety of using Mobic with your doctor. Side effects: Common side effects of Mobic include upset stomach, nausea, dizziness, and rash. Serious side effects may include cardiovascular thrombotic events, gastrointestinal bleeding, liver problems, kidney issues, severe allergic reactions, and high blood pressure. Prolonged use of NSAIDs may also increase the risk of renal toxicities. Patients should monitor for symptoms such as chest pain, weakness, shortness of breath, slurred speech, stomach pain, blood in stools, jaundice, and little or no urination. Consult your doctor immediately if you experience any severe side effects. Interactions: Meloxicam can interact with other medications, including blood thinners, ACE inhibitors, diuretics, and lithium. Inform your doctor about all medications, supplements, and herbal products you are currently taking to avoid potential adverse interactions. Dosage: The typical adult dose for osteoarthritis or rheumatoid arthritis is 7.5 mg once daily, which can be increased to a maximum of 15 mg per day based on your doctor's recommendation. For children with juvenile rheumatoid arthritis, the dosage is typically calculated based on weight. Always follow your doctor's instructions and do not adjust your dose without consulting them. Avoid: Patients taking Mobic should avoid alcohol as it can increase the risk of stomach bleeding. It is also advisable to avoid taking other NSAIDs concurrently, as this can increase the risk of side effects. Due to its potential to cause dizziness, caution is recommended when driving or operating heavy machinery. FAQ: Many people inquire about the suitability of Mobic for children. Meloxicam is approved for the treatment of juvenile rheumatoid arthritis in children aged 2 years and older. However, its safety and effectiveness in children under 2 years old have not been established. Closing: This concludes our discussion on Meloxicam, or Mobic. This information is provided to educate and should not replace the advice of a healthcare professional. Always consult with your healthcare provider for any concerns or questions you might have. Thank you for joining us today.